Welcome to Renuka Eye Institute, Barasat. Today, a grade 6 cataract is going to be operated by a fellow candidate. A keratome entry of 2.8 mm is made temporarily in the cornea. Injection lignocaine 2% is instilled intracamerally as she is going to perform the procedure under topical anesthesia. Leathery hard nucleus, lack of epinuclear layer, thinning of capsule and weak zonules makes the case of hard cataract very challenging for a beginner. Anterior capsule is stained with trypan blue dye. Poor fundal glow makes the capsular axis visualization difficult in hard cataract. Hence staining is important. And also capsular edges are better visualized during chopping. OVDs are very important during this surgery. It is very important to use soft shell technique by a beginner, or else you can come outside again and again and inject viscoelastic at each step in order to protect the endothelium of cornea. Now she is going to perform capsular access. She is using cystitome. A small flap is raised, and now by applying shearing force, she is continuing the rhexis. Always try to apply the shearing force rather than ripping while doing rhexis in hard cataract, as capsule on hard cataract are little fragile. You can also start with double rhexis if you are not very confident with rhexis at your beginning stage. Look how beautifully a 5.5 mm rhexis has been made. Now two southport entries at 9 o'clock and 3 o'clock position she is going to make. Now she is going to inject a small amount of fluid underneath the rhexis margin, but before it is important to wash some viscoelastic present inside the anterior chamber. A little hydrodissection or no hydrodissection is generally required in hard cataract. The fluid wave cannot be visualized, so subtle anterior movement of cataract confirms the passage of fluid. Be slow, do not be in a hurry. Now she is going to use a Sinskey hook in order to rotate the nucleus. No, it is not the right technique. Always try to engage the hook at the edge of the nucleus and then try to rotate it. Don't try to push the nucleus. As a beginner, a stop and chop or divide and conquer technique is little safe in hard cataract. So now she is going to make a trench. A trench has to be little wide and deep in hard cataract. Always apply power while moving forward and do not apply power when coming backward. Here she is not stabilizing the nucleus with the chopper, but it is important to always stabilize the nucleus with chopper. Don't try to push the nucleus as posterior capsule is very thin and the chances of drop nucleus is high. So make a wide trench in order to prevent occlusion of the phaco tip and be little deep. The deeper groove is made till the fundal glow is better visualized. Low vacuum and high power is delivered in a continuous mode. Now, place the phaco tip and chopper deep in the groove, parallel to each other, and divide it into two pieces. The nuclear piece should be divided such that the posterior plate of the nucleus is fully divided, as it is very important to complete the phaco. Inject viscoelastic at each step. Now she is going to embed the tip in the nucleus piece. Try to hold it in position 2. Try to maintain that hold and then chop it. It is a very common mistake by a beginner, as they are little superficial in embedding the phaco tip, and now this has happened. So regrasp the nucleus, try to hold it in deeper plane and then divide it. Initially you can divide it into 4 to 8 pieces and then emulsify one piece, or look, the iris is coming out from one of the side port, so inject viscoelastic, try to push back the iris. She is trying to rotate the other half of the nucleus but is not able to do it properly. Now try to hold one nuclear piece at its thickest edge. Try to bring it centrally. Allow the vacuum to build and then chop it. Now emulsify the chopped piece in a quadrant mode. At this place, it is very important to embed the tip deeply inside the nucleus. Try to maintain the hold and then divide. Otherwise, there will be the destabilization in the nucleus, as we can see here. It is very common for a beginner to do this. Always try to do phacoemulsification in pupillary plane. Be slow, don't be in a hurry. Now try to rotate the other half of the nucleus. No, not like that. It will not be in a hole. It is important to rotate the nucleus and then try to embed the tip in a deeper plane. Always avoid shattering of pieces, as any small piece can hit the PC and can land you in a big trouble. So try to come out, inject the viscoelastic and push the PC behind. Always be very careful as there is no epinuclear plate behind. So now she is continuing the phaco. During quadrant removal, high vacuum and high AFR with moderate power is used. Now this is the last piece which she is emulsifying. As a beginner, if you find any difficulty, you can continue this in epinuclear mode also. So now the phacoemulsification is completed. Irrigation and aspiration is done. There is very little for irrigation and aspiration to do as it is a very hard cataract. So now the lens is placed in the bag. Little bit viscoelastic has been washed out. All the 3 ports are hydrated and intracameral Vigamox is given. This video is a teaching video and we have no financial disclosure present. Thank you.